It's people like Juliet who've been at greater risk of dying from COVID-19 from the offset of this pandemic. Why? Because she's black, from an ethnic minority. Just aged 57, her family said she had the most infectious smile. She was kind, caring, and thoughtful.
It's painful, the pain is just too much to bear. And my late wife was Shami. She was a very looking woman. She was loved. She loved to help others.
Juliet's husband too had coronavirus, and now we know thousands of other black, Asian and minority ethnic people who've succumbed to this virus face the greatest risk. That's why, for weeks, we've witnessed a disproportionate number of deaths within this vulnerable community. Figures from the ONS reveal that people from black, Asian and minority ethnic communities are more likely to die from COVID-19 compared to their white counterparts. Black women are 4.3 times more likely to die than white women, and black men are 4.2 times more likely. When these figures are adjusted for other factors, such as deprivation and underlying health issues, the odds of someone from a BAME background dying from this virus are reduced. But black and South Asian people are still almost twice as likely to die. Researchers also found that while people from BAME backgrounds are at a higher risk of death, it is only partly down to underlying health conditions and deprivation. One factor which could also play a role is key worker jobs that people from this community have.
A lot of the people working in frontline occupations, not just in health work, but in supermarkets, in transport, all over the place, the people who are getting the most exposure to COVID are much more likely to be from black and minority ethnic backgrounds.
It's the first time we've seen detailed data like this, and the findings are alarming. In response to Sky News, the government made it clear, despite after pages of research and official information, they still aren't prepared to shield this hurting community.
We'll take decisions as policymakers when we've got clear advice from PHE on the causes and the implications and what we could responsibly do.
But Juliet's daughter wants to see changes.
What we actually need to focus on is now, what is it that is causing this? And I feel like it's highly social inequality. We need to think of the jobs that people have. We as blacks, as Asians, as a community, we are put at risk every single day.
All along, this issue has been clear, and the faces of those who've lost their lives during this outbreak show it. The real life and death implications of social inequality are becoming increasingly apparent, but it's taken a global pandemic and thousands of deaths to highlight it. Inzamam Rashid, Sky News.